I guess I wanted to start, Leslie, with just, I guess, introductions. I mean,
Okay,
you and I know each other, but for anybody on the Zoom, do you want to start?
sure. I'm happy to. Hi, everybody, and happy Birth Center Week. I am Leslie Welch. I'm co-founder and CEO of Birth Center Equity, and also co-founder of my local birth center, which is Birth Detroit.
Hi, everybody. I'm Tatyana Ali. Happy Birth Center Week. Birth Center Week. I'm so
Awesome.
excited about this week. I'm an actress and a singer. I've been performing since I was a very little girl. After my own personal experience, I became a Black maternal health advocate. And most recently, I founded a baby quilt company called Baby Yams. And Baby Yams donates 10% of every blanket that we sell to organizations that uplift and give grants and scholarships to midwives, to Black and Indigenous midwives and doulas. And so we're so aligned, and I'm so excited to be here. Part of the whole purpose of Baby Yams was a way to, if they're beautiful blankets, it's meant as a covering, but also the real power behind it, I hope, is the ability to amplify the message of work like you're doing, the work that you're doing. How to create spaces where we are covered, and we are taken care of. And so I guess I'll start with real foundational questions. Um, could you explain what Birth Center Week is? You started it. It's your brainchild.
Yes. So, 3 years ago, I started Birth Center Week with another artist and activist named China Tolliver.
Mm,
And we wanted folks to know that birth centers exist, right? That right now, birth centers are kind of a boutique model of care that only some people have access to. And when we think about the number of birth centers in this country, very few are owned or led by Black and Indigenous and people of color. And as we endeavor to open them to provide our communities the best possible midwifery led care, we also need to do the job of raising awareness of what they are and why we need them and what our families can expect from them. And so it was created to uplift the power and potential of birth centers, to improve our health and also to improve our experience. Because, like you said, we should expect to be covered. Birth is a sacred experience, and to survive it is the
mm.
least of what we should expect.
Why is it important to really to focus on um, birth centers led by Black and Indigenous people and people of color?
Mhm. Because we know that culturally reverent care matters, right?
Culturally reverent.
Yes. So it is
Yes.
not just that you want to go someplace where you're tolerated, or where it's okay for you to be there. You want to feel respected, feel affirmed, and even feel loved, is what we say, right? So to
Mhm.
feel honored and loved during the time of pregnancy and birth, and be in a space where you feel comfortable and you feel understood. And that is one of the reasons our birth centers are super important for birthing people of color. But also, what we know is that birth centers that are built with equity and cultural reverence in mind are better for everybody. Everybody reports a better experience and greater autonomy and respect when these factors are considered.
When you said loving hands, it makes me think of the experience that I had with my midwife for my youngest child after the experience I had before at the hospital, and just the vast difference there of the quality of care. It was so incredibly different. You have an incredible goal that you are um, that you are putting in front of all of us this year, and that is the beloved 50 by 50. Could you explain to people, explain what that is?
Yes. The goal that we are inviting everyone to across the country is Beloved Birth 50 by 50 is the goal that by 2050, 50% of babies in the US be born in the care of midwives. And we set that goal because we know that midwifery care matters. It saves lives, it enhances our birthing experiences, it is um, cost effective for our whole healthcare system, and it
Mhm.
improves all the outcomes that us public health people say we care about, right? So we want to make sure that more people in the US have access to midwifery care, and not only that it is available, but that it becomes the norm because it's the gold standard for normal physiological birth. So we define beloved birth as birth that is family centered,
Yeah.
is midwife led with physician collaboration, that is community held, and that honors the inherent value of all people. And so, yeah.
I want to get into a little bit about of your story, that you were
Mhm.
so generous in sharing in the M House Diaries, your experience in public health and how that led you to your birth center in Detroit and to this work now.
Yes. This work is personal, professional, political, all the things to me. As I shared, my first birth was a preterm baby. My Zoe was born preterm. She's now 19 and healthy and beautiful and great. I experienced a loss in between, and then my rainbow baby is 11 and is healthy and great. And also, I was with my brother and sister-in-law when my nephew was born and died the same day. Um, and so we know the experience and the joys and grief, right, of pregnancy and
Mhm.
childbirth, and the things that are statistics to some people, like that's my family,
Yeah,
and it really just shifted how I, as a public health professional, thought about the work. It's like every baby is my baby. And
yeah.
so think about every baby as our babies, every birthing person as like our people,
Is
our
my
family.
sister, my brother, yes.
What do we want for each other, right? We all want safe and loving birth experiences. And so that inspired me to endeavor to build a birth center in Detroit. I was also serving as deputy of public health and got to see just on a large scale what was missing and really understood that midwives were missing. So I was so grateful to find my dream mates. Charlie Snow's a certified nurse midwife. Nicole White is a certified professional midwife, and Alon Jaffard is a doula extraordinaire. We found each other 5 years ago, and we built Birth Detroit together, and it's phenomenal. Babies are born there now, as Nicole says, in rooms full of love.
Yeah.
And I feel so proud of that. And I started BCE with Nashira Burrell Boston, who was also building her birth center and still building it. But it's so that, more folks across the country can have that experience.
I mentioned on the Instagram live that just this last weekend I was in DC, and while I was there, I visited Mama Toto Village in DC. And I want to ask you to speak on what it means in the community to have a birth center in the community, how it impact how it I just got this sense of this incredible overflow from that space. Um, could you speak to that?
Mm. I think birth centers um, offer so much more than just a place to have your baby,
Mm.
right? So midwives provide care from period to period and can care for you before and after pregnancy and childbirth and care for your baby, your newborn for some time. And we offer a whole host of other supports for the community. So education, childbirth education, newborn infant care. Some of our birth centers in our network offer mental health support, other support groups for moms and for dads, and what it means to be right in a community and for folks to know you're there is for folks to know that they're not alone and that
Mm.
there's someone to help them as they grow their families. And I think one of my favorite stories about ours is folks who just walk in because they have a question, right? Or need
Yeah.
help. Or we had a dad who was facing some challenges and he came to Birth Detroit because he didn't know where else he could go. And so I think that, it's a warm and receptive community hub almost for a lot of communities and a safe haven. When you talked about feeling covered, a safe haven, a safe harbor. Um, and it can mean so much.
How many birth centers are in your network?
We have
And
50.
how and how and I'm sorry. Um, I there's we're talking about well, I mean, we're seeing and we're experiencing the kind of a deletion of reproductive rights and healthcare options, and money's going towards healthcare. And people are talking about nationally, they're talking about maternal care deserts, the few that exist in certain areas, the few places where people can go, shutting down even now before the laws go into effect. Um, so could you talk about the network of birth center equity and how that relates to those spaces and to that sort of national news that we see?
hmm So at BCE, we have a network of 58 developing and established birth centers led by Black, Indigenous, and people of color across the country. What that means, though, is that about 20 of them are open and providing birth center birth today, and that the other 38 in our network are working to raise money to open their birth centers to provide birth center birth, but might be providing right now easy access clinic services, doula services, childbirth education, and a variety
Mm.
of other services. And in the context of what is shifting now, our birth centers are more important now than ever. And in some areas really being, overwhelmed by the need in their communities as these other facilities close.
How are you? One of the things that uh, capacity and need. The need, I'm sure, is so great. I'm sure the waiting list that do you do you have a sense of the waiting list at the waiting lists at birth centers? Um, because that visit that I had in DC, when I saw the space and I saw the level of work and organization and services, I just thought, oh my gosh, everybody must want to come. Everybody
Good.
must want to come here. Do you have the capacity to, to serve everyone that wants to come through those doors? Um,
We need more birth centers.
yeah.
Would just say we absolutely need more birth centers, and it's one of the pathways in Beloved Birth 50 by 50 is to grow more birth centers so we can meet that demand, so that none of our birth centers would have to turn people away, right? Some are, booked into the new year for births, right?
Wow.
Um, and we see, a varying volume depending upon the size of the center. So some of our centers have, a couple of births a month, up to the largest birth center in the Birth Center Equity Network serves 500 births a year, right?
Wow.
Um, and what's interesting about it too is that in this environment where our birth centers can be and are such a safe space and a safety net for families, that, that our centers would have to struggle at all to provide the care that they provide, you know? That shouldn't be the case in a country like ours where our healthcare expenditure is so high, right? And where wealth is so great. Folks,
Mhm.
folks, we need to shift how we do things.
Yeah, it's a cultural shift. It's a it's also an investment shift.
Mhm.
I was so amazed in my experience, the kind of the life-threatening experience I had at the hospital cost $250,000. That was the bill. And luckily, I was covered. You know, I had my union coverage, my husband had
Mhm.
his coverage, all that passed. When I worked with my midwife, I paid $8,000 out of pocket. And I fought with my insurance company for 2.5 years to be reimbursed
That's
for
crazy.
that. And when you look at that, you're like, what are we doing?
That's
How does this make any sense at all?
it,
It's who is it serving in the way that it works now?
no one,
Um,
which is the paradox of it, right? Like even the hospitals that were doing birth, they're closing because they can't financially sustain it. And it's because our system is topsy-turvy.
yeah.
All of our, all of our folks should not be going to hospitals and having unnecessary traumatic experiences, right? When only a handful of us truly need specialized medical care and obstetric surgery and all the interventions, right?
Um, I have there's when I think about people that get to experience that kind of care, the what it did for me in my life, I just want to share that, and then I want to ask you to expound on the dream. Um, it just the importance of this kind of care and and people in our community experiencing it. It changed my life.
Yeah,
I didn't know it could be like that. I
yeah.
didn't know that care could be like that.
Mm,
Services that we need, that everybody needs. As human
every
beings, we all need.
we
Some
all
get
need.
and some don't. That's the difference. But it changed, completely shifted my perspective of how I move in the world and how the world should interact with me, how these systems should interact with me. It changed my life as a mother, as a woman, as just in all facets of my life. And so to get that experience in your
All of
home base, in your community of, oh, this is what it's like to go into some place, to be treated with respect,
yes,
for someone to spend time with me, to understand my needs, to ask me to express them. This is
yes.
what it looks like for somebody to say, "Can I touch you?"
Mm-hmm. Mm-hmm.
It is that's one of that I just want to get that across in terms of the overflow of what it means of what it means to have birth centers in communities.
The
Um,
overflow is so beyond that moment. Like as you said, it changes how you think about yourself, your body, your baby, your family, your own personal power and potential. And
yes.
even what will it mean for our babies when they tell their birth stories, you know? And midwives, you can have midwives in every birth setting. I had my midwives in a hospital setting because there's no birth center at the time where I am. But now there is, and there'll be a birth center for my babies when they have theirs, you know?
Mm. Could you expound upon the dream of Beloved Birth 50 by 50? Um, you stated the goal, but how do we get there, and how can people from where they are move with you in that vision?
Yes. So the
Let
dream
us
is,
dream with you.
yes, please. The dream is if you could envision it, like the experience you described, for it not to be unusual, but for it to be the norm. And so, for all families to walk into care spaces where they feel centered and seen and respected and understood, for them to receive the best possible care for their level of need, right? So, 60% of us can safely give birth with midwives in a community setting, and that is not common knowledge. We want people to know that, right?
Right.
We want our physicians to collaborate with midwives so that the 60% of us that can safely give birth with midwives in a community setting, we do that thing, and physicians are there, to support the midwives as collaborators if needed. And then that other 40% of us, we stay with the specialized care with physicians, right?
Mhm.
That in doing that, that we can shift more than just the safety and autonomy of the birth experience, but we can shift how we're born in this country to truly honor the life experience of pregnancy and birth. And we outline 6 pathways to help get us there, because what we know is that the birth culture we have today, um, providers didn't build that alone. Doctors didn't create it alone. They don't support it alone, right? And the same is true for midwifery care. We have to finance midwifery care, which is
Mhm.
pathway number one. We have to
Mhm.
increase the midwifery workforce, which is pathway number two. We have to grow our birth centers, which is pathway number three. Every community should have access to a birth center. Pathway number four is our health systems integration, right? This is for all birth settings. Midwives practice in all birth settings. And we need our health systems to know that and support that. And five, policies and regulations. We need our policies and regulations at the federal level and the local level to support midwifery and birth center care. And finally, number six would be culture and changing how we talk about birth, moving hearts and minds of millions to think about midwifery care.
Okay, so can we get into them?
Yes,
Is that
let's
cool?
do it.
Okay.
Yes, I'm
So,
ready.
okay, one, finance.
Yes.
I explained to you, I think it was either on the IG live or earlier, that I was just at the Association of African American Financial Advisors. And I thought it
Mhm.
was so incredible to be in that space speaking about maternal health, Black maternal health. Um, and I know some members might have been like, why are we talking about this? What are we doing here? Because we're talking about
Mhm.
investment and where it goes.
Yes.
So is it because some people that might be where they can help and where they can be a part of
Yes.
the dream. Yes.
On the finance side, you can be a part of the dream in so many ways. One is looking first in your community. You can support your local birth center, right? There are 400 birth centers across the country, right? There are about 20 established birth centers open and led by Black, Indigenous, and people of color across the country right now.
Wow.
Only 20 of them. And so when you
Wow.
think about, the financial power of the group that you were with, right? What if they collectively invested in
Listen, Linda. That's where my mind. That's what I'm. That's why I keep bringing it up.
yes, what
Led
if
by a
they
phenomenal,
invested in
phenomenal
that?
Black woman. Like,
Yes. What if they collectively invested? We have
yes,
um so, in our network, that 58 number of members, we want to keep the 20 established birth centers open and help them grow and thrive. And those 38 that have yet to open, we want to support their opening, right?
yeah,
To get them to the finish line, to open those doors in their communities. And folks who want to donate or invest can do that. And birth center equity can help facilitate that. And there are a whole host also of other supports to help make that possible. And I would add that, it's an investment in our collective future, right? It's an
Yes,
investment in our collective future, not just an investment in a moment.
that's right.
Um, And then there are folks in so many seats of leadership across finance. So, not just with the ability to donate and invest, but with the ability to decide, right? The ability to decide how healthcare is financed at a payer level, the
Mm,
ability to decide, how healthcare facilities are financed and built. Choose birth centers. Choose
right.
to reimburse midwives today at parity for the care they provide. So many folks don't understand that, there are so many decisions that can be made at the payer level or at the employer level to support
Uh,
this work. And so, my invitation to people is to take action to the greatest extent possible within your sphere of influence, right?
yes, yes. Um, okay, that's one. I mean, I'm
That's
sure
one.
that, but we're just kind of um two, growing the midwifery workforce, growing the workforce. Um, that's what Baby Yams has donated towards
Yes.
grants and scholarships for Black and Indigenous midwives and doulas. Making that, and choosing to work with organizations like Birth Future Foundation,
Mhm.
um, that make the grant process possible. Grants are very hard to get, scholarships can be very difficult to get, but making that possible. Can you talk a little bit about the midwifery workforce? Because even on Baby Yams, we're a store, we're an e-commerce site, but I get emails all the time from people who are young people who are looking to that as
Yeah.
their purpose, their calling, and what they
Mhm.
want to do in the earth. And I think that there's n- there's never been a time like this,
Right.
where there's support for that growth and support for that work, because it's a very blessed calling.
It is a very blessed calling. And I do want to say, I'm not a midwife. I am what
Hmm.
my colleague Keisha Good calls a midwife enthusiast, right?
Yes, me too.
And but I know that increasing the number of midwives we have available in our communities is critical. And that's multi-layered because we want our midwives to be supported with our students to be supported with the scholarships that you talked about, to be supported
Mhm.
to pursue their training. There are multiple ways to train to become a midwife, right? And we
Yeah.
support um, midwifery across credentials, right? So that we have all kinds of midwives in our communities. And when we think about supporting the workforce, we need to be able to keep our midwifery schools open. Number
Yeah.
one, right? There are midwifery schools who have closed in the last couple of years. There are midwifery programs that are threatened right now with the federal policy changes that have jeopardized scholarships for students. That's another place, again, as Baby Yams is doing, where folks could invest and support scholarships. And we also need to, our workforce starts early. Even our K through 12 teachers who are doing career days with students, um,
Mm.
invite a midwife to career day. Let's talk about midwifery care. Everyone can take Beloved Birth 50 by 50 and make it their own to uplift
Yes.
and create change and plant the seeds early so our children
Yes.
know about the profession of midwifery, and also its phenomenal history. We'll have a Birth Justice Origins project that'll launch with Southern Birth Justice Network later this month to talk about just that history so folks understand, right? Midwifery is not new.
Hmm.
It was intentionally and deliberately undermined in this country in the 1920s, and it was intentionally and deliberately changed. Birth was moved out of the hands of our midwives, particularly Black and
Yes.
Indigenous midwives, and into the hands of physicians and hospitals. And our opportunity now, since we know change can happen because we saw it historically, is that if it can change once, it can change again. If it can change with ill intention, it can change even faster with beloved intention, right? And increasing our workforce, is one step too, one step of the six.
Yes. Yes. Um, there's also birth centers also potentially. I know midwives have to work with preceptors to get their hours to become credentialed to work hand in hand with more established midwives. That's part of the education, and the proliferation of birth centers led by Black and Indigenous people um, just allows for a totally different preceptor relationship and ability to gain that knowledge. It just kind of compounds on itself.
Absolutely.
Um,
And we don't have enough spaces for that right now, right?
yeah,
So we need more midwives overall in this country, and in particular, we do need more midwives of color to precept our students, to pass on knowledge and wisdom, and to create safe spaces for education and learning, the same way we
yeah,
want to create safe spaces for birth.
yes, yes. Three, which we've been talking about this whole time, growing birth centers. I don't know if there's anything else you want to add. I mean, I'm sure there's more than you want to add to that, but that's what, you
That
know.
I would add,
Um,
Tatiana, that right now in the US, birth centers are the only healthcare facilities centered around the midwifery model of care. And that's why they're critical and important. That the goal of Beloved Birth 50 by 50 is a cross birth setting, hospital, birth center, and home. But right now, the only healthcare facilities that truly center the midwifery model of care and midwifery leadership our birth centers. And
yeah,
so let's start there. Let's increase the number of birth centers. Let's support your local birth center. Let's
yeah,
support birth center equity. Let's support American Association of Birth Centers. We all systems go.
all systems go. Um, you mentioned, okay, so the fourth
Hmm.
pathway, health system intersections.
Hmm.
Could you get into that a little bit?
Yeah. I One of the fundamental pillars in beloved birth is, that birth be midwife led with physician collaboration, and that we honor and respect the medical or the health providers training and credentials is what I want to say, that we honor and
Mm,
respect the health providers training and credentials. Midwives specialize in normal physiological birth, period, and 60% of our births are that. And so we ideally want to create a health system where everyone is in the best place for their needs. We've created a system in this country where everybody receives highly medicalized birth care, even if they
yes,
don't need it. And we wonder why it's not working. We've created a system where everybody receives, the number 10 response, even if they would have been safer and happier at a number 2 or 5. That's like
yeah,
an analogy, but, and for that
it's a
reason,
good one.
it means that we overspend and we underdeliver right now in the United States. And we don't need to do that. We need our physicians and health systems administrators to understand the power and potential of midwifery care, to know and form relationships with the midwives in their communities, right? A lot of the power dynamic needs to be shifted and changed when we
Yes.
think about how midwives are received by hospitals and health systems. And so it was important for us to put health system integration there so that we can change
Yeah.
the conversation, all to benefit families, right? So if we center families instead of providers, right? So we put families in the center and we say, what does this family need? Most of the families need a midwife, and then some of the families need a physician led birth.
Yes. I think sometimes when people think of birth centers or they think of midwifery care they think of it as an either or. And what you're describing is like it's like a turning of the ship with respect for the knowledge and the expertise of midwives
Mhm.
and a turning of the whole ship. I remember learning that there are that predominantly OBGYNs have never seen a natural birth. Through their
Right.
schooling, in their schooling,
Right.
that's not even a part of it. And so when you get to the 10 that you're talking about, right, is the enormous, I mean, that is our C-section rate in this
Mhm.
country.
Mhm.
That's
Mhm.
that 10 because that's the training. So I love that integration part. And my way of having said it in my advocacy is like we should have all the things. Whatever the things are that we need that we
We
need.
can have all the things. We should all have access to all the safe birth options. And
Yes.
even when we think about like hospitals and C-sections, our highest risk families should be in hospitals, right?
Hmm.
They should. And they are the families who may need that type of critical support and intervention and that
Sure.
level of help. And then the majority of us, in fact, don't, you know?
Right.
Um,
Right.
and I think that, or I know that, if we shifted and recreated our health systems with the knowledge and data and experience and with holding these truths in mind, we could not only help our families be healthier, but we could also financially sustain it. We wouldn't have the closures and the
Right.
challenges that we see today if we had a risk appropriate system of maternal care, which we don't right now.
So I'm gonna overview the pathways that we've gone through. One,
Okay.
the financial pathway. Two, growing the midwifery workforce. Three, growing birth centers. Four, what we were just talking about now, health system integration. Um, Birth centers is a way to write this whole thing. Um, and then and now we're at five, policy regulations. Am I right in
Mhm.
saying that?
Yes.
Policy. I did I did a jingle for a little while a couple years back for the Momnibus bill.
We love
Get
the
on.
omnibus.
Yeah, I put a song to everything. Show. Look,
Are you
get
gonna sing
on
it
the
for us?
bus, the mom the bus.
Okay.
It was like a. Did you know? Did you know? Did you know? Um, and Black Maternal Health Caucus, Lauren Underwood, Alma Adams, just all these incredible policymakers. Um, it's been up many times. I think only one part of it was passed during COVID that had to do with um, vaccinations. But it's exciting I mean, not I know that pieces of it that some states have created their own versions, and that
Mhm.
pieces have been passed in some of the states. What are the policies that Birth Center Equity is looking at? And for people where that's the thing that they get excited about and want to speak about and want to share news on,
Mhm.
um, or lobby for and call for. What are
Mhm.
those policies?
So, excuse me. I think I would first start by saying that there's federal policies like the federal Momnibus at the
Hmm.
national level that are speaking about, and much of the policies and regulations that impact the practice of midwives and birth centers are at the local and state level.
Hmm.
Vary. And so at the national level today, you can find action alerts related to birth centers around the Babies Act, around the Midwives for Moms Act. Those are some things that are moving right now, and there's more information about those at American Association of Birth Centers website. There's, as you said, the federal omnibus package, and we should continue to advocate, right, for the things that we need at the federal level and to hold those things in mind. And then at the local level, there are a number of states that moved omnibus packages in the last couple of years.
Hmm.
Colorado did, I know we did here in Michigan, that helped to ensure that midwives are recognized in our states, to ensure that midwives are reimbursed, and not only reimbursed, but reimbursed at the level of parity of the care they provide, right? So if midwives and physicians are providing the same service for normal birth, they should be paid the same rate
Yes.
for normal birth. And our birth center facilities should be recognized as such and paid the associated fees that hospitals are paid as facilities. And there are so many ways in which we need to restructure our healthcare policies with midwifery as the gold standard for birth care.
Mm. And people can also go on the Birth Center Equity website
Yes.
for
Yeah.
that information. Yeah.
Hmm.
Um, and six is culture change. How do you envision ways of changing the culture, getting the news out, getting the information out? One thing that you mentioned, which I thought was such a good idea, and this is because I I come from a lot of my cousins are teachers. When you
Yeah.
mentioned bringing in midwives, when you talk about career day with our kids and um, thinking about them as an integral part of our communities, um, what do you envision for culture change?
Yes. Moving hearts and minds of millions is where we can all impact this change, right?
Hmm.
It is about the stories we tell. We
Yeah.
want to tell beloved birth stories. We want to share our birth stories, not just the ones that were difficult and traumatic, right? We want to share stories of what is possible in pregnancy and birth. We want to share stories of what we dream for our children and our children's children in pregnancy and birth. And anybody can do that. Anybody can do that. We have resources on the Beloved Birth 50 by 50 site where you can host and do a Beloved Birth Circle. Just have folks over. Just talk to your family about midwives,
Oh,
and make it your own. We can all do or say something around this issue because we've all been born. I We've all been born. Everybody has a birth story. What if we shared our birth stories with each other? What if that,
oh,
became a thing that we did? And also, I'll say, just from an organizing perspective, that our some of our greatest and most successful movements in our history have really engaged at multiple levels in culture, and that includes celebrities and media, for you all to uplift the power and potential of midwifery care, and even think about where it's depicted on TV in general, right?
oh,
Our
I
culture
know.
has depicted birth as a medical emergency for decades. And what if we told a different story? And telling a different story starts at the beginning. What are the birth stories we tell our kids?
Yeah.
What do we tell them to expect for pregnancy and birth? What do we tell them is possible in terms of what you can be, right? I know in my family, I grew up at a time where, as a young Black woman going to college, it was like you're supposed to be a doctor, an engineer, or,
Or a
there's just
lawyer
like this list,
or a
or a lawyer,
yeah.
right? And what if we tell a different story that includes midwifery, that makes that an aspiration and a goal to be the birth wisdom holders in community, like our ancestor midwives once were? We need that.
When I started to tell my story, I've always made sure to it's both my birth stories. That's where it is. But what amazed me in my family is that
Mhm.
when I started to speak and share, I started to hear the women in my family share their stories. And I
Mhm.
didn't realize that that space was missing
Yes.
until until it existed. And it's almost like a back pain. Do you understand a back pain where and then you do a little acupuncture, you're like, oh, I'm going to exercise now, and then one day you wake up and you're like, oh, the pain is gone.
Yeah.
you
Oh,
you
we want to
there's
all
a
wake up and know the pain is gone from birth.
exactly, and there's that's I think that used to exist,
Mm-hmm.
that space for us to share, that space for us to share our stories, to share information, to share all the ways that it could be. Let me tell you, I had shared my story all over to people, and my dad was like, "I was born, my me and I was born. A midwife took care of my mom. That's how I was born." I was like, "Dad."
Absolutely. Yes.
So creating that space where it becomes natural to talk about.
Nat Natural to talk about it, and to talk about it intergenerationally, like
Yes, an integrated part of our lives.
to ask our
Not,
mothers, our grandmothers, our great grandmothers, what was your birth experience? To ask
yeah,
our fathers, our grandfathers, our great grandfathers, our uncles and what was your birth experience? Is important. Um, and so yeah, we want to shift
there.
how we think about it. Shift how we think about it. Shift what we expect. Um, and understand that her person that we're born can be gentler.
Could you say that again? You just clipped out on it might just be on my end. The very
And
last thing you said.
I was saying how we're born can be gentler.
Yeah.
One of the articles my co-founder for BCE, Nashira, and I wrote is about um, birth and birth center births as a portal to gentle futures, right? If we were all born in a safe, loving, gentle environment, we were all born honoring the inherent power and potential in our bodies and supported with the right support at the right time from the right provider. How would it change how we see ourselves?
How we move in the world.
Mhm. Yeah.
That's that soft
Mhm.
life that people have been talking a lot about on social
Versus,
time, but to the millionth power.
yes, it's like you're
Like
working
from the
so
ins
hard.
yes. Yes. I wanna take a second and um, look to the chat. There's a lot that's been going on in this chat space, and thank you so much for everybody who's writing in here. Um, from Sandra Poole, oh, last week California legislature passed AB 55, which would remove barriers to licensing birth centers in the state.
Yes.
Kelly, the legislation
Mhm.
is now headed to the governor for his hopeful signature. Come on, Gavin. Come on.
All right now.
Happy to be in the room and hear about such an important topic. Here's from a birth and postpartum doula, Olivia Francis, as well as a public health practitioner here. Excited to learn more from this conversation. Here's a student, Faith Lucas Scott. I'm a DNP student working with postpartum support group as my project at Birth Detroit. So happy to be part of this
Oh,
journey.
yes. I love
Yes,
it.
midwifery care changes people's lives. This
Absolutely.
way, for sure, affordable, loving, and yet not supported by the system. Midwives and birth centers make sense.
Oh,
I'm
that's
fortunate to be.
Marina, an indigenous midwife who runs Indigenous Birth. She's fantastic. That's who that comment is from.
Oh, from where in the country?
Um,
From
um,
Michigan or?
no, so she's located on the West Coast, in Arizona, and her organization is Indigenous Birth and supports access to education and training and all the things for Indigenous midwives. So shout out to Indigenous Birth.
Yes. Um, let's see. Oh, Linda Quinn, birth centers are never talked about. I never knew so I never knew with having four children that it was even an option. I was under the assumption the hospital was the only place. That's, I think, and that is, I think, true for a lot of people. This is good information. I'm pursuing my dream of being a midwife. Yes. Still
And
at ED Tech now. I'm thankful the Zoom is being had. Sending love from Educated Birth. Hi, Cheyenne.
hi,
Hello. We
thank you for
love birth centers
joining.
and birth justice.
Thank you, thank you.
Um, I'm a 39-year-old mom with a healthy 7-year-old who was delivered naturally in a hospital with no interventions. I live in the Bay Area and I'm seeking support in conceiving a second child, but I've been struggling. Are there any referral resources available in the Bay Area? Could you, Leslie Welch, is there, I just said Leslie Welch. Leslie, is that,
That's what.
I mean, that's your name.
Yes.
But still, that was like,
So,
um,
on our website, on Birth Center Equity's website, we do have a list of Black and Indigenous-led birth centers across the country. And so that is one place to start.
yeah,
And also, if you don't see what you're looking for there, you can find a more expansive list of birth centers across the country on the American Association of Birth Centers website. I will say, if somebody is in the Bay Area, there's a fabulous midwife colleague there. I was just with her at a conference. Kiki Jordan is working on building a birth center there and is a practicing Black midwife in the Bay Area. So, um, shout out there specifically if that's what you're looking for. I would say,
yeah. Yeah, so Jenna, I hope you heard that. Um, she says, I feel frustrated with the generic scripted responses I've been receiving and would appreciate more personalized guidance. That's something I also experienced that once I worked with a midwife, I thought about the totality of my reproductive care in a completely different way. And
yeah.
I also seek different I it's like it's like you can't go back. You can't go back to the no, I can't say that on a Zoom, but you can't go back to the nonsense um, after you've had that experience. So
Absolutely.
good luck on your journey, and you know check out those resources that Leslie mentioned. Um, um, let's see. I think that's it for the chat. And Jan, thank you so much. Um, even though my birth plan was clear. Thank you for sharing your story here on the chat. There are a lot of um, there are a lot of similarities in my birth story too. But being in the Bay, I know you'll be able to find the care that you need. But reach out to these organizations because that's what they're here for. Um, I want to make sure that I don't go over time. Oh, we have
Okay.
3 minutes left. We have three
Yeah.
minutes left.
About the pledge and invite people to take the beloved birth pledge. Is that okay?
Yes. Oh, I just lost my earring. Oh no.
Uh-oh.
Am I ready to fight? No. Hold up. Um, yes. So what do you want to go ahead? I signed the pledge. I signed the pledge just this morning, early this morning. Um, go ahead, Leslie. Invite everybody.
I invite everyone on the call, if on the Zoom, on the wherever you're seeing this, whenever you're seeing it, take out your phone right now. Go to belovedbirth50by50.org and click on Take the Pledge. The pledge
Yes,
is simply I pledge to use my voice, my ideas, and my actions to support the Beloved Birth 50 by 50 goal. Very simple, but very powerful. And if we are all making that commitment and affirming that and moving in that direction, there is no stopping us.
there is no stopping us. I always say, and because I believe it, I believe it. I believe it. We have everything we need. We have
Love it.
everything we need if we bring it together and we work together to create the future that we want. Um, and with everything that's going on, it's like a now, it's a present moment thing. The need is now. The need is now. And the building is happening now. I am so enamored by your work and
Thank
the boldness of your vision, the vision of your organization, and truly everybody in this community that does this work. Your tremendous power in your work to heal.
Mhm.
I'm just
And
always it's such a beautiful path to liberation.
thank
Um,
you. Thank you.
yeah, and I'm dreaming with you, and we're all dreaming with you. And remember, whenever you're seeing this, because this Zoom will be made available, I'm sure in different spaces. Whenever you're coming to see this, like make that pledge. And this is really there are a lot of
Make
different paths, but this is the one.
make that pledge and know that I share this with folks and I'm going to keep saying it that we don't have to agree on everything to agree on this one thing that we
Mm,
want our babies born safely and lovingly and gently, right? And so
yes.
the pledge, Beloved Birth 50 by 50, is for everyone. Please take the pledge.
Take the pledge. Happy Monday, y'all. Happy Birth Center Equity Week. I will be following you, Leslie, and everything you do this week. I'm sure it's like, I'm sure it's going to be an amazing week. And I'll be reposting and I'm so happy to be dreaming with you.
I'm so happy to be singing with you. And thank you for giving us a song too to go with all that we're doing.
Let's go out on the song. You want to go out on the song? Birth Center Week. Do, do, do. National Birth Center Week.
And
Take the
thank
pledge. We love you. Thank you so much for being with us this morning, everybody.
you, everyone.